Hello, and thanks for viewing. My name is Adrian Brine. I'm a partnerships manager at Citation. I'm joined by Antony, director of the SDEA, and he'll be in conversation with James Norman, a health and safety team leader at Citation. So, Antony, over to you.
Thanks, Aid. So we'll just start with some general questions. Firstly, does the use of air conditioning spread the risk of virus transmission?
So the virus, obviously, as people should be aware, is it's transmitted through the air, through droplets. There have been quite a bit of research into this. I believe the HSC have put some information and guidance out regarding this. The current line is that it is extremely low in terms of the risk of spreading it through the aircon system. There is possible more heightened risk if it's using recirculated air rather than pumping in fresh air into the room. And the key thing, I guess, to remember is with the virus, is one of the key controls is to keep the ventilation high. So keeping natural fresh air pumped into rooms and buildings, keeping windows and doors open, that helps. So as long as it's fresh air or it's putting some fresh air into the actual system, then it should be fairly low. But it is advisable that if you're using any systems which are recirculating air, then they should be switched off and you should be looking at more natural ventilation. But ultimately, the best thing to do is check with your aircon service engineer, your HVAC engineers, and they should give you some advice specific to your system.
Fantastic. Next question. If the use of showers or changing rooms is a must on site or at work, what measures should members put in place to keep people safe?
It's very simple, really. When it comes to any shared common areas, whether that's showers, toilets, canteens, you just need to have some really clear guidance for your staff on what they should be doing and how they should keep the areas clean and safe. How are you going to implement social distancing in those areas? Could be quite pinch point situations, so signage and floor markings. Ensuring that the guidance and the clear instructions you have tell your staff they shouldn't be leaving things in the showers, so things like shower gels, personal equipment, and they should be cleaned down after each use. And then after that, obviously make sure they're part of your enhanced cleaning regime as well, as part of the whole premises, so they're regularly cleaned throughout the day as well. But it's important to have clear guidance set out for those areas, because ultimately showers may be required if you've got a particularly dirty job, which requires you to keep clean throughout the day. So it's important for obviously hygiene reasons that that's maintained.
Fantastic. Can employees travel together to work or to sites in the same vehicle?
It's preferred that they don't, purely because social distancing can be quite difficult. And if you can't, if they have to travel together, if there's no other way around it, then you need to put in some mitigating factors to keep them safe. And that could be a number of reasons. It could be ensuring that the same people travel to work together in the same vehicles at all times. So that's what we call a cohort or a fixed partner team. I guess the easiest way to think about it is a bubble. That's been quite a common word being used at the moment. So keeping your teams in bubbles like that. Ensuring you, as you would with the workplace, making sure that the vehicle's regularly cleaned and they're following good hand hygiene. They need to keep the ventilation well as well in the vehicles, so keeping the windows down, and instructions not to have any face-to-face contact. I think it's a good idea as well to put some signage in the vehicle, just some small signage, like maybe a little sticker above the dash, just to say, social distancing needs to be adhered to. Ideally, if you can sit one in the front, one in the back, if that's a possibility, that would be a good way of keeping them safe as well. The bigger the vehicle, the easier it is. And so it does depend on the vehicle. But if you've got like a minibus, for example, you can obviously quite easily socially distance in that. Whereas if it's like a small van with only two seats in the front, that makes it a bit more difficult.
Okay, thank you. Can employees share tools or equipment at work?
Again, advisable if you can not make that happen. That would be the best solution. But similar to when you're traveling in a vehicle, you need to apply some ways of keeping people safe. So that if they are going to have to share equipment or any tools, then obviously they'll need to be cleaned down after each use, and making sure that the staff are trained in good hand hygiene. And ultimately, I would also try and stick to fixed teams again, so bubbles where the same people are using the same equipment. But I think if you get to that point, the business needs to take a serious question to itself and ask itself, is that job or task essential for my business? If it's not essential, then we should look at ways of rearranging the work so that doesn't need to take place at this time. If it is essential, then again, mitigating factors need to be put in place.
Okay, thank you. And just one of the final one on general questions. What are the implications around first aid provision during the COVID-19?
So first aid arrangements needs to be reviewed at this time. I've been advising my clients to ensure that they've reviewed their first aid needs assessment for their organisation and ensuring that there's suitable first aid cover, because ultimately there could be less people off work at the moment. They could be on furlough, they could be working from home. So the first aid trained staff may not be in the actual workspace as they would normally. So making sure you've got good cover is important. Secondly, first aiders themselves should be aware of the current guidance. So social distancing should be still adhered to if it can. So what that means is if they can instruct someone how to administer first aid on themselves, it's safe, for minor sort of cuts and things, then that's fine. If they can't, then ultimately preserving life should take more priority because it's an emergency situation. So they might need to break the social distancing rules for that particular moment. But what they'll need to do is make sure that they monitor themselves for symptoms of coronavirus for at least 14 days and obviously follow isolation guidelines. And I guess one last point on that is important is the current guidance is not to administer rescue breaths if CPR is required. Chest compressions are fine, but rescue breaths, it's potentially quite risky doing that. I think ultimately the first aider will have to really think about the training they've had and decide if that's really required. But chest compressions will probably be suitable in most situations, but they'll have to assess it at that time to determine if that is it. And the final thing is making sure the first aiders have got the right PPE. So there is some PPE first aiders should have: disposable aprons, eye protection, fluid repellent, surgical masks, and then any PPE that's that's used would obviously need to be disposed of correctly as well.